All right, today we're going to tackle a topic that's absolutely fundamental to our long-term health, but one that often comes with a lot of questions: preventative screenings. Let's dive into how these checkups can empower you to take real, meaningful control of your well-being.
This statement right here, it's really the core of everything we're about to talk about. It's so simple, right? But it's also incredibly powerful, and it changes the whole conversation. See, this isn't about being scared of what a doctor might find. It's about getting the life-changing advantage of finding something early.
Okay, so let's zoom out for a second and start with the big picture. Why is prevention such a cornerstone, such a big deal in modern healthcare? This right here is such a powerful way to look at things. We hear words like cancer and heart disease, and they sound huge and intimidating. And while they are absolutely serious, the crucial point here is that we aren't powerless. Early detection gives us the upper hand, and it can turn what might have been a crisis into a much more manageable situation.
So, that brings us to the how. How do we detect things early? Well, that's where screenings come in. Let's break down exactly what we mean when we use that word.
This definition, it highlights the key difference perfectly. Most of us go to the doctor when we feel sick. That's a reactive approach. Screenings are completely proactive. It's like checking under the hood of your car when it's running perfectly fine, just to make sure it stays that way. So a screening isn't just one single test. It covers a few critical areas, from specific cancer risks and heart health to how our daily habits and even our family history might play a role. It's really a holistic 360-degree check-in. All of this information is great, but it all leads to the most important question of all. Does this actually apply to you? Okay, this is where we get personal. We've talked about the what and the why of screenings, but right now, let's have you think about your own health journey. Just take a moment and look at this list. These are some of the key flags that suggest a screening could be a really smart move. Of course, you've got age and family history, but notice how many of these are tied to our lifestyle and other existing conditions. Seriously, if even one of these makes you think, that's me, it's a strong signal that it might be time to have a conversation with your doctor. All right, so let's say you've decided, okay, I'm going to get a screening. What does that actually look like? For a lot of us, the unknown can feel a bit intimidating, so let's pull back the curtain. That is a great question, and the answer is actually really reassuring. It's a structured, step-by-step journey, not just a random collection of tests. This lays out the journey so well. It all starts with a simple conversation about your risks. From there, you move on to some lab testing. If anything needs a closer look, that might lead to an imaging referral. But what I think is so crucial are the last two steps: lifestyle counseling and a follow-up plan. This shows it's not just about finding problems, it's about creating a personalized roadmap for your health moving forward. So what kind of tests are we really talking about here? For your heart, it could be a simple ECG to check its rhythm or a blood test for cholesterol. When it comes to cancer, screenings can range from routine procedures like pap smears to simple take-home stool tests. It's all about using the right tool for the right job. Now, this is a really important question because, let's be honest, it's a barrier for a lot of people. The fear that a screening might be painful or invasive can honestly stop someone from taking a potentially life-saving step. And the answer is so reassuring. The vast majority of initial screening tests are super straightforward and minimally invasive. We're often just talking about a simple blood draw or an imaging scan. The goal is always to gather information as easily and as comfortably as possible. Here's another really practical and important question. Is this a one-time thing or is it a regular commitment? So the general rule of thumb is to think of it annually, making it part of your yearly health routine. But the most important piece of advice here is to follow your physician's recommendation. Everyone's health profile is unique, and your screening schedule should absolutely reflect that. As we start to wrap up, I want to leave you with a final and I think really empowering idea. This whole thing is about putting you in the driver's seat of your own health. I love this comparison because it's so true. A healthy lifestyle is your daily defense system. It's essential. A preventive screening is your periodic expert inspection. One can't replace the other. They have to work together as a team to keep you in the best possible shape. And this right here is the ultimate takeaway. Let's reframe this whole concept one last time. Screening isn't about looking for sickness. It's about gaining knowledge, building confidence, and empowering you to live your healthiest, most vibrant life. So I'll just leave you with this question to think about. It doesn't have to be some huge leap. Maybe it's looking into your family's health history. Maybe it's just booking that annual checkup you've been putting off. What is one proactive choice you can make for your health starting today? Thanks for joining me.